We are live. I am Karen Ray. This is Fave at 5. Welcome, ladies. I have a special guest with me today. I have Dr. Keira Barr, and we are going to be talking about menopause. Some of you have been asking, and so I thought, let's talk about some of the things that that maybe women are afraid to ask or talk about. And Keira, your title today was What You Didn't Expect When You Were Expecting Menopause: How to Handle Your Skin Issues Without Gimmicks, Fads, or Trends. So I wake up this morning, I have to totally laugh because I noticed my skin was breaking out. I'm like, seriously, I'm almost 60 years old. So Keira, good to have you here. Why don't you tell us a little bit about you, and then we'll go into the topic for today.
Yeah, absolutely. Well, thank you for having me. Yeah, I think that is, in the textbooks, they say acne should end at 25, and that is complete BS. So here we are as adult women, and we're still breaking out. So I am very passionate about this topic, menopause, first of all, because that's the stage that I'm at. And I think there's so many misconceptions, and there are so many things, so many experiences that women have, and they struggle with them. And I think we're made to feel like we just have to suck it up, and that isn't true. And for me, I kind of learned a very hard way how much of a role hormones play in your life. And I feel like it's a long story, but just to backtrack a little bit, when I was in my late 30s, I was into ultra running. Mm-hmm. I ran a lot, and I didn't realize the stress that it had on my body. And unfortunately, in addition to having chronic pain, I started to have all sorts of other issues, bloating and gut issues and feminine issues of having periods that would last forever. And my doctor didn't think to check my hormones. They're just like, oh, here's this pill for your gut. Your cycle will just even itself out at some point. And, we're just giving me diagnoses and pills for every symptom that I had. And if I had known then what I know now, what I realized is that I was, number one, the stress on my body from the over-exercising was not good for me. And it messed with my hormone balancing. But I was also heading into perimenopause. Oh. And a lot of the shifts and the changes were because my hormones were out of balance and they were naturally declining. Our progesterone starts to decline in your mid to late 30s. And my doctors never once thought to check my hormone levels.
Wow.
Or even put that on the table. And so now that I'm older and more shifts and changes have occurred, I realize that it's so important. Number one, education is key, and to support all the women who are really suffering and struggling, knowing that it doesn't have to be that way. So out of my own misfortune, because I had wound up having lots of pathology that I discovered only on at the time of having to have surgery, I realized that so many women could be spared that experience if we just start having these conversations and start talking about stuff.
Yes. So just to give the ladies a kind of a brief overview, you are a doctor and you were practicing in dermatology. And now you are specializing in menopause and hormones. Right. I'm not sure if I'm saying that all correctly, but so, where was the transition? And obviously it's very important to you and as you are aging yourself and to talk about this topic. So so how did that piece come about?
Yeah, so I know I kind of just like dove right in there. So yeah, my background is I'm a board certified dermatologist. So for me, it's always been about, I was dermatology and dermatopathology. So studying skin on the surface and underneath the microscope beneath it. And as I've gotten older and I've had my whole host of health issues, it's become even more important to me that it's not just what shows up on your skin, It's how we show up in it, right? And how we feel in it determines how, all the choices that we make in our lives. So it's become much more than just a study of the skin. Your skin actually, as your largest organ, it is a window to and reflection of your overall state of health and well-being. And I think that, we take it for granted. We're like, oh, it's just, skin on the surface, you just cut it out and forget about it. But our skin is amazing in the sense that a lot of the hormones that are made within the body are actually made within the skin. So the link between skin and hormones is very intimate and intricate, and it makes perfect sense, I feel, for this transition that going into working with bioidentical hormones and helping women, because the impact that even hormones in general, like the big ones, thyroid hormone significantly impacts your skin, and estrogen, one of the big ones, it has a significant impact on helping us keep that radiant and youthful glow. And testosterone is, our androgens are one of the big keys for why women are getting facial hair and acne as we mature. So skin and our hormones is very intimately connected. So for me, as I, because my own health issues, got into more of the integrative kind of functional holistic approach and the natural progression as I got older. And, I think a lot of us in medicine, you teach best what you need to learn the most. And because I was going through all these hurdles and obstacles, I kind of had to crawl my way out. And I thought, well, if I'm struggling with it, other women have to be too. And it just made sense to just be able to help women who are at this stage of life.
I love it. Yes. And, there's so much about our skin, and we're seeing ourselves age. And if there's something, and I think you wrote it here too, there's plenty that we can do about our skin without spending a ton of money, and without doing the trends and the fads. And so that's what our goal here today is, to tap into a little bit of that. And your first point here was talking about the declining levels of hormones and the impact on your skin.
Mm-hmm.
Yeah. So explain that to us.
Yes. Okay. So, unfortunately, our hormones decrease as we mature, right? And the big ones being progesterone, estrogen, and testosterone and DHEA. And how the levels of hormones impact our skin health. Starting in the first 5 years after menopause, collagen decreases by 30%. And then it continues to decline after that. So collagen and elastin are the supportive tissues in our skin that make it, I'm like holding my face. It gives it that a plump, radiant, youthful glow. And as estrogen declines, estrogen plays a huge role on the hydration of the skin, and not only creating collagen, but preventing its breakdown. So as the hormones decrease, that's why we see an increase in fine lines and wrinkles as we mature and go through menopause. It's why some people may have more easy bruising, because the supportive connective tissue, the collagen and the elastin, is breaking down. So the protection around those vessels is there. Plus, in sun exposed area, sun damage also accelerates the destruction of the collagen and elastin. The big ones, like you mentioned, with acne. So what happens with our hormones is that progesterone and estrogen are decreasing in menopause. Testosterone, your androgens, are decreasing as well, but not at the same rate. So what happens is that you have this relative male hormone dominance, the androgen dominance, and that testosterone, those androgens, stimulate your oil glands. That's why you may discover you're like, I don't get it. I'm oily and dry at the same time. Well, the androgens are stimulating those oil glands, but the estrogen, which kept your skin up well hydrated and moisturized, well, that's going down. So now you're dry. So you've got both things playing off each other.
Wow, it gets a little complex, doesn't it?
It does. It really does. But but once you enter, it makes sense. And it's your body. I think one of the things that I love to share is when things are popping up on our skin, or we're having aches and pains in our body, your skin and your body are not trying to sabotage you, and they're not trying to make your life miserable. What your body and your skin is doing are sending you messages that they need, that things are changing, that especially if you're having hot flashes or you're breaking out, that your skin is asking for a little extra support, a little TLC. And so these are just messages, they're clues that things are changing, and it's a window of opportunity to be able to take a look at what's happening in our life right now to see if there's some things that we can modify to ease those symptoms.
I like that. So so let's talk more about that. So what are the biggest myths about hormone replacement?
Yeah,
I think around that.
Yeah, so hormone replenishment is one of the greatest things that we can do for our bodies to protect our mental well-being. So we know that as we get older, cognitive decline, bone health, cardiovascular health, vaginal health. And so the issue with hormones is that there is a lot of fear out there that replacing hormone replacement therapy will increase the risk of cancer, heart attack, and stroke. And this is all because of a study that came out, the Women's Health Initiative study that came out in 2002, that even though it wasn't statistically significant, which is doctor speak for the results that they got, did not show that there was a significant difference between those who got hormones and those who didn't. But they basically took that little information and ran with it. And at the time of that study, the researchers knew that that information was actually not true. And so there's been follow-up studies that have shown, including the researchers from that study, that the information that they were putting out there was not accurate. Because what we know is that women who are treated with hormone replacement therapy are actually at lower risk for developing breast cancer than those women who are not treated. And we know for certain that the benefits of treating with hormone replacement therapy on cardiovascular health, I mean, heart attacks kill more women than cancer does. And so estrogen is incredibly cardioprotective. Same thing with osteoporosis and osteopenia. We know that we need our hormones to keep our bones, strong. And think about, how many of us have had kids and, urinary urgency, frequency? Well, our hormones, especially the testosterone and the estrogen, they're important to support the muscles of the bladder and also the vaginal mucosa. So as those, are declining, women, the adult diaper industry is huge and depends on all of that. So by replenishing those hormones, you actually, not to youthful levels, you just want to get to healthy levels, and you could prevent so many of these things that so many women suffer with. So yeah, the risks are not, and everyone is individual. I'm not saying by any means, there are risks and benefits to everything. But in 2002, the millions of women who were getting hormones, their doctors were fearful to keep prescribing based on the study, and the women were afraid to take the treatment because of the study, and the study was not giving the right information.
Well, that's interesting. So I had no idea that hormone imbalance will cause all those kinds of issues. You think of them all as separate, different things, and not all related.
That's right. As we get older too, we think we're just getting more forgetful. We're just, but cognitive decline is one of the biggest symptoms that many women experience, and they don't put two and two, they don't connect the dots that it's because their hormones are going down. They're like, it's just because I'm getting older. And there's a lot of factors that can play into, our environment, our lifestyle, and things like that. But our hormones play a huge role in our cognitive health.
Hmm. So I have to share a story today. I was at the grocery store and I must have left my cart. I went to go grab a bag of lettuce, those pre-mixed salads, and I actually threw it in somebody else's cart and took their cart. I'm like, oh no, it's
That is
happening.
so funny. Although I think that's probably happened
a little bit more.
Yeah. Yeah, that's and sometimes though I've done that too. And I'm like, ooh, there's the stuff in their cart looks better than mine. Maybe I should take their cart.
Yeah, as long as we can laugh at ourselves but still,
oh my God, yes.
And improve how we're living and what we're doing. So, so what can we do today to balance out our hormones and have that radiating glow again? What are some things that we can do?
Yeah, absolutely. There's a lot that we can do. Certainly when I work with clients, we sit down and we determine whether hormone replenishment therapy is appropriate. But just backtracking, I was sharing before we got started that I went for a hike today. So, and being out in nature, and it's a simple thing. It's literally how we sleep, who we spend our time with, what is on our plate, the products that we put on our body, so many things that you're doing day to day that can make a huge impact. When we talk about menopause, one of the biggest things is hot flashes, right? Hot flashes are something that they're bearable, but they can be very unpleasant. And one of the biggest triggers for hot flashes, and many of us don't think about this, if we have our glass of wine at night. So, right? So, so blood sugar balance and alcohol. So eating lots of sweets and alcohol can make those symptoms worse. So just looking at our diet and our lifestyle, I'm not saying go without your glass of wine. I'm just saying maybe have it a few hours earlier so it's not as close to evening, and picking the highest quality product that you can. But just simple things of stress, how we deal with stress. Right now, we are in unprecedented times.
Yeah.
And learning stress management skills, and that's part of what I teach. I'm actually teaching a course to healthcare practitioners about mind-body skills, because it's so important that in order to treat our clients and our patients better, we have to take a step back and practice self-care as well. So all of these things, like, how you just before you even sit down to eat, taking a few deep breaths and just putting yourself in a place of relaxation so that you can digest that food, that you can actually absorb those nutrients, because you need those building blocks from your food to create your hormones and have your body functioning well. So it's just the simple things that can make a huge difference. And those don't cost a thing. They don't cost a thing.
Healthy living.
That's right. It's absolutely true. And creating community. I mean, what you're doing with Fave, I mean, being able to have conversations, connection, because most of us, I think, we feel we are in this alone, that we're the only ones who is experiencing certain things. But having that opportunity to let it be known that you're not the only one, breaking out, and there's a good reason why, and it's not just in your head. I think, one of the biggest things in menopause is so many women experience increased anxiety and depression. And part of that is, people think, oh, it's just life, I'm busy, like, and my kids are, I have teenagers, they're driving me nuts. But progesterone is one of the first hormones to decrease. And progesterone is incredibly important for helping to generate a chemical in your brain called GABA, which creates calm and relaxation. And as we go through menopause and you're not ovulating as frequently, your progesterone levels start to go down. So that ability to get calm and relaxed also goes down. So women start to notice that they are getting more anxious. And they're like, I don't know where this came from. Why is this happening? Well, it's because your hormones are declining.
Oh, so I had a period where I had a lot of anxiety. I had a lot of stress and stuff, but it just seemed like the anxiety was just overboard. And that would explain a lot. Just thinking we knew all these things. And that's why we have you here. And what a
Yeah.
great session. So, gosh, so many things. So if women would like to have further discussion with you, what kind of programs, how do they get a hold of you, and how do they find you?
Yeah. So it's, when women are, if they are going through menopause and are not sure where to start, if hormone replenishment therapy is what they need, or they're really looking, they're not sure if they want hormone replacement therapy, but they're looking for lifestyle and, just things that they can do from a more holistic perspective. I cover the gamut. And so my website is a great place. drkirabarr.com is a great place to find me. I'm actually, it's getting revamped. So good, some more good information specifically geared toward the midlife woman and really helping her thrive. And so there's a glowing skin guide on there that you'll be able to download as a free download, really just giving information, easily implementable information that you could start using right away.
Excellent. Well, and we'll have you put your links and everything in the comments too, so women can find you, because obviously this is something that we all go through. And just think, if we just knew, like you said, education is power. And if we have this information, we can make life just a little bit simpler, and we'll all be glowing and we'll be radiating.
That's right. That's right. We all want to radiate our glow.
Oh, absolutely. Well, Keira, thank you for coming and joining me at Favorite 5. And what a great topic, and look forward to chatting again.
Thank you so much. It was super fun.
Okay, bye now.
Bye.